Dr. Matt.
How are you?
I'm good. How are you?
I'm good, thank you. I see here you made a 4 o'clock appointment.
Yes, I did. I had a little bit of an accident last week. I was riding my bike. I hadn't done that in a while, so to be honest, I was a little bit wobbly at first.
Okay.
I thought I got the hang of it, and I guess I didn't, because I fell down. Kind of injured my shoulder a little bit. A few scrapes on my knee, but not very important.
So it's the left shoulder.
Yes, my left.
And how's the pain on a scale of 0 to 10?
I would say maybe a 4 or 5. Like, it's not too bad, but it's just there.
Is it radiating down the spine or up to the neck?
I would say up to the neck a little bit.
Okay.
And it does bother me when I try to like reach something really high, or like this is, I just don't want to move it too much.
Okay. And you also mentioned you bumped your head as well.
Yeah, I did.
Okay.
Yeah, I've just been having a bit of a headache since then.
Okay. Any dizziness? Any vomiting?
No, not really.
Okay. And have you noticed any vision problems, any changes in your smell or your taste?
No vision problems.
Okay.
No taste or smell.
And what about hearing or your ears? Have you noticed anything coming out of your ears, any discharge?
I do have this like high-pitched sound that I hear sometimes. So I don't know if that could be related.
Okay. Is that constant or it comes and goes?
No, it just kind of comes and goes.
Okay. Do you have any allergies?
Nope.
Can you please verify your first and last name and your date of birth?
Yes, first name is Ivy B.
Okay.
Last name ASMR.
Okay.
Date of birth is August 31st, 1992.
Are you on any daily medications?
No, I just take vitamins.
Okay. Were you able to go back to work after your accident?
Yeah.
Okay. If you need any days off, just let me know after the exam and after we find a diagnosis for you. If you need some time off, I can definitely do that for you.
Okay, thank you.
Okay, so let's go ahead and begin. Are you experiencing any tingling sensations on your fingers or toes?
No.
So what I'm going to do is I'll take your blood pressure first. Is it okay if I use this arm?
Yeah, sure.
Okay. Sorry. Okay. Go ahead and relax. Okay. Blood pressure looks good. Let's go ahead and check your oxygenation. So I'm going to put this on your finger. Go ahead and relax. And I'm going to listen to your heart as well. Is it okay if I put the stethoscope underneath your shirt?
Yeah.
Okay. Okay, so just breathe normal. can hear only S1 and S2, no S3, no S4. Oxygenation is 96 percentile, room air, heart rate is 88. So that really tells me that there is a good amount of oxygen flowing to the brain. Blood pressure 121 over 78. Heart rate 88. Oxygenation 96 percentile. Okay, Ivy, so I'm gonna go ahead and do a vision check. Can you please look straight in my nose? Okay. So I'm checking your pupils. Make sure that they constrict equally. They're also accommodating. Okay, good. Okay. Go ahead and cover one eye, please. Great. And can you please hold this chart with your opposite hand? Go ahead and extend it all the way up. And can you please tell me if you can read this row right here?
Kind of.
Okay. Go ahead and read this one.
937826.
Okay, go ahead and change eyes now. Switch eyes. Can you please tell me what number you see right here?
3.
What number do you see here?
7.
And which circle is bigger, 2 or 3?
3.
Okay. Can you please read the last row, but starting with the last number?
Yeah, that's 826739.
Okay. I'm gonna go ahead and check your smell. Is it okay if I palpate your nose a little bit?
Yeah.
Just want to make sure that there is no pain. Okay, perfect. And I'm gonna go ahead and cover one nostril. Can you please breathe in, breathe out? Again, breathe in, breathe out. Okay, so both nares are patent. Keep your eyes closed and tell me if you can distinguish this smell. If you can
It
identify
smells
it.
like lavender.
Okay. Go ahead and do a taste check. Okay, so I'll put this on your tongue. Go ahead and open. Can you please tell me what that tastes like?
It tastes like pineapple.
Okay, perfect. Alright, so now I'm gonna go ahead and check your hearing. So what I'll do is I'll create a sound and I'll put it right here behind your ear. I'm gonna need you to tell me when you don't hear the sound anymore.
Okay.
Can you hear this?
Yeah.
Tell me when you don't hear it anymore.
No.
Can you hear this?
Barely.
Okay. Tell me when you don't hear it anymore.
I don't hear it anymore.
Can you hear this?
Yeah. No.
Okay. Can you hear this?
Yes.
Tell me when you don't hear it anymore.
No.
Can you hear this?
Yes.
Tell me when you don't hear it.
No.
Good. Okay, go ahead and tell me which position here is louder. Position number 1 or position number 2?
2.
Same thing. Position number 1 or position number 2?
2.
I'm gonna go ahead and check your facial sensation now. So what I'll do is I'll touch you on your face and on your chest and maybe on your arms as well with 2 different textures. One is gonna be sharp and one is gonna be dull. So I'm gonna go ahead and show you what sharp will feel like.
Okay.
And this is what dull will feel like.
Okay.
So go ahead and keep your eyes closed and tell me if it's sharp or dull.
Sharp. Dull. sharp, dull, sharp, dull. Sorry, that was dull.
Yes.
Dull.
Very good.
Sharp, dull, sharp, sharp, dull, sharp, sharp, dull, dull, sharp, dull, sharp, dull, sharp, sharp, dull.
Okay, perfect. So that looks very good. What I'm going to do is I will check your muscles and your reflexes. Can you please give me a big smile? Perfect. And I'll go ahead and frown. Puff your cheeks. Give them puff for me, please. Okay, very good. Go ahead and relax. And I'm going to try to open your eyes. Go ahead and close them. I'm going to try to open them. Don't let me open them. Okay, very good. And now I'm going to try to push down your eyebrows. Can you please lift them up? And I'm going to try to push down. Okay, good. And I'm going to try to turn your head that way, but I need you to resist that, okay? Okay, very good. And now I'm going to try to turn your head the other way. I need you to resist that. Okay, great. Can you please shrug your shoulders? Okay, great. Go ahead and extend your arms like this for me. Squeeze my fingers. Good. I'm going to try to open up your arms. Don't let me do that. Okay, good. I'm going to try to close them. Don't let me do that. Okay. Try to push them down. And I'm going to try to push them up. Okay, go ahead and relax.
It does hurt a little bit on this side.
Okay. Well, from what I was able to notice, there are really no abnormalities with your cranial nerves. So that's reassuring. What I'll do now is I'll have you change and I will examine your shoulder. Is that okay?
Okay.
Perfect. Okay, Ivy, so what I'm going to do now is I will check your range of motion and also your scapula mobility to make sure that the shoulder joint is still intact. And also I will check your ligaments and your muscle flexibility. So relax your arm and I'll make some movements very gently. Tell me if you feel any kind of pain.
Kind of like right there it starts.
Okay, so I definitely felt a clicking sound. Very faint, but it was there. Okay, go ahead and extend your arm.
That feels really tight. Yeah.
There you go. So this is the maximum that you could do without any pain. There you go. So whenever you do this motion, I definitely can feel a clicking sound over here. After this, I'm going to go ahead and compare both shoulders to make sure that there is no inflammation, and if there is, we're going to have to write down in the chart.
Right there it doesn't really hurt too much.
Okay.
It's mostly when I move it up.
Any pain here?
It just feels like really tense or tight. Yeah, kind of like right there.
Okay. So both shoulders are aligned. I'm not noticing any asymmetry. I'm gonna go ahead and palpate right here in the back. I'm not noticing any redness, no swelling. Okay, and I'm going to check your head as well, since the shoulder joint is also connected to the spine.
I do have a little bit of a headache right now.
Okay. So the headache can be very much related to the tension that you're feeling here because of the accident and what happened. There's a lot of strain put on your shoulder joint and right here on these muscles, also on your sternocleidomastoid muscle. There's a lot of inflammation here. So all of that strain is radiating to the pain that you're feeling in your head, causing you headache. Okay. I'm gonna go ahead and measure you. All the way to the acromion. So now it would be 35 and a half. Okay. Well, it's a very good sign. I'm not noticing any inflammation, so both shoulders are symmetric. Okay, let's go ahead and I will check your sensation around this area.
Okay.
Go ahead and tell me when you feel this.
I feel it now. 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 Now.
Okay. I'm gonna go ahead and check your scapula mobility. So for that, I will go ahead and gently press down around it. We can definitely work on that. Okay, I'm gonna go ahead and compare. What I'm gonna do now is I'll create a vibration and I'll put it on the bony prominences of your back and your shoulders. I'm gonna need you to tell me when you don't feel the vibration anymore.
Okay.
Do you feel that?
Yes.
Okay, tell me when it stops.
No.
Good. Do you feel that?
Yes.
Go ahead and tell me when it stops.
No.
Do you feel that?
Yes. No.
Do you feel that?
Yeah. No.
Good. And now I'm going to go ahead and compare with your other shoulder. Do you feel that?
Yes.
Tell me when it stops.
No.
You feel that?
Yes.
Tell me when it stops.
No.
Do you feel that?
Yes.
Tell me when it stops.
No.
Okay. So I'm definitely noticing a delay in your responses on the left side. What I would like to do now is to check your sensation to cold. So go ahead and keep your eyes closed and tell me when you feel the sensation.
No.
Okay.
No. 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 No.
Okay. Did you feel the coldness equally on both sides?
I'm not sure.
What about now?
I think it feels colder on the right side.
Okay. What about now?
That feels about the same. Same. The right side feels
Okay.
colder.
So right here is the spot that you kind of lost your sensation. So what I'm gonna do now is I will tap on your shoulder joint and on your back. Tell me if you feel this.
Yeah.
Any pain radiating anywhere else?
No, just kind of like up here, like from this area. It feels
Okay.
like.
I'm gonna check other sides, so we definitely know that this side hurts. Any pain here?
Yeah, a little bit.
Okay, so this side too. Any pain here?
No.
I'm going to tap along your scapula. Tell me if you feel any pain.
No. 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 No.
Okay, so what I'm going to do now is I'll tap along your spine. Tell me if you feel any kind of pain.
No. 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 No.
Okay, so there is no damage to the spinal cord. Okay, so what I'm going to do now is I'll check your sensations here around the scapula and a little bit on the shoulder joint and also on this side as it goes and it travels back to the spinal cord. So what I'll do is I will touch you with two different textures. This is what sharp will feel like. So that's sharp. And then I'll touch you with a dull texture. This is what dull will feel like.
Okay.
Okay, so go ahead and keep your eyes closed and tell me if you feel sharp or dull.
Dull. Sharp. Dull. Sharp. 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 Dull. Dull. Dull.
I'm gonna do now is I want to test if you can distinguish which part of your body, which side of your body I'm touching you on. So go ahead and tell me if it's right or left.
Left. Right. Left. Right. Left. Left. Right. Left. Left. Right. Left. Right. Right. Left. Left. Right. Left. Left. Right. Left. 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 Right. Right.
Okay. Everything looks very normal. I'm gonna go ahead and just listen to the joint. I'm gonna go ahead and make some movements. Go ahead and relax. There it is. Okay. How's the clicking sound? It's still there. Okay, so what I'm gonna do is I will apply kinesiology tape and also perform a shoulder adjustment. The kinesiology tape is gonna go right here along your back.
Okay.
And what's really gonna help is to keep the muscles and the joints connected. It's also a reminder for you to try to keep your body in an aligned position. Okay. Are you ready for an adjustment?
Yeah.
Okay. So what I'm gonna have you do is to take a deep breath in when I'll tell you, okay? So go ahead and relax for now. But just so you know, I'll ask you to take a deep breath in, and that's when we will do the adjustment. I'm trying to find your center. There it is. Okay? Go ahead and take a deep breath in, okay? And breathe out. Just enough to stretch those muscles. And same thing on the other side. Take a deep breath in and breathe out. Okay. Perfect. Okay, Ivy, so what I'm gonna suggest now is for you to put a lot of ice on that shoulder. Also, you can take ibuprofen as needed only. Do not take it around the clock yet, because I think your pain is manageable, and the ice will definitely help with inflammation. Take it easy for the next few days and try to not lift heavier than 5 pounds. That's definitely going to help to keep the muscles together, and they're going to heal a lot faster.
Okay.
Do you have any questions for me?
No, I don't think so.
Okay. Well, if the pain worsens, go ahead and give me a call, and I'll try to see you sooner than the 2 weeks follow-up, okay?
Okay, sounds good.
Okay.
Thank you.
You're welcome. It was a pleasure. I'll see you soon.
Thanks.